Yeovil District Hospital is a small district general hospital located in Somerset. We provide the usual range of general hospital services through from A&E to maternity services, inpatient, outpatient services. Like everybody in the NHS, we're facing some significant challenges, both in terms of demand pressures on the hospital and financial pressures. And a key part of that is how we utilise our estate and our facilities to the best use. So we felt it was an opportunity to go and seek a partner who could come and work with us to help realise our ambitions for the organisation and the site, but could work alongside us and really get to know what we were trying to do and what we're trying to achieve. I think there's obviously a lot of things that we're doing at the moment that are quite immediate in terms of delivering our special care baby unit refurb, the introduction of a modular ward, the building of the car park. I think our progress on a number of these projects has been accelerated quite considerably, partly because of the expertise that Prime bring to the table, but also because of the resources and capacity that they have.
The partnership is a key delivery vehicle for our strategy. So our strategy is wide-ranging and all-encompassing and covers a whole host of different areas. Everything that we do should be about the patient experience, and we've got limited capital to be able to deliver improvements and enhance the infrastructure to improve that patient visitor staff experience. Initially we had 2 or 3 schemes that we focused on. That was around the main entrance development, car parking and a hospital hotel. On the ground, the main entrance project has run really successfully. So far, with the projects that we've delivered, there has been a win-win.
Our approach is to, again, sit down with the Trust, with the estates team, and ask them what they need from us. We recognise that they are incredibly good at what they do. They already run their estates, they know more about the estates than anybody else does, but they haven't got the time and they haven't got the resources to do everything that they need to do. I think what interests us as individuals, and therefore as a business as a whole, is doing new things, because we recognise that what our client base is looking for is something to meet their current needs, not something that met their needs yesterday or the day before. So we recognise that things keep on changing from an NHS perspective, and we need to keep changing to meet those requirements.
Prime have been very good at bringing in specialist resource around whether it's project management, whether it's people with clinical background who understand about service redesign and how capital and estates projects need to be built around a clinical model. So there's a great deal of expertise being brought to the table, which is very broad across a range of areas, and also being able to access and think about different sources of funding for capital projects at a time when the NHS is particularly challenged in terms of its own financial resources. Be able to think about how we draw in investors and other financial opportunities to think about some of our key strategic projects has been really important, and certainly their expertise in that area has been invaluable over the past few months. Our strategy very much into the future is not just focusing on what we do as a hospital, but thinking about how we work as part of a local health and care system, because obviously the hospital doesn't exist in isolation from primary care, GP surgeries, community services. And so our strategy is very much looking how we can integrate, particularly with primary care in the future. Prime have a lot of experience of working not just in the hospital sector but also outside of hospitals with primary care, and our future as an organisation is very much about looking at a different model of care locally, which is going to see a greater level of integration between primary care and secondary care.
Up in the Wirral, we worked with the PCT in 2012 to look at a way in which we could fund a big project that they had up there in a very different way. They had some money, but they didn't have enough money in order to develop the whole scheme. So they came to us and we came up with a shared ownership agreement, which then allowed the health solution that the PCT were looking for to materialise.
It was Prime's experience in delivering primary care premises nationally that gave us the confidence to go with them and use them for the scheme. St Cann's Health Centre was originally a large Victorian hospital. Victorian buildings don't lend themselves to 21st century healthcare, in effect. So Prime helpfully provided the capital for us, helped us with developing the design, working with the architects. So they played a crucial role really, and really helped us with our vision. I think sometimes we were struggling with the design, with the site, and they enabled us to step back and consider what we wanted to achieve. This is the first time that the building framework for the NHS had encompassed a shared investment model, whereby the NHS provided part fund as a private partner did, but using the framework for building new facilities. It was quite key and quite unique to get the money in via that route. So nationally it's the first time it had been done on health premises, so we're quite proud of that really.
The partnership has the potential to change the face of the trust. It is changing the face of the trust.
We have a 20-year site master plan that we want to see developed for the hospital here, and I think having a strategic partner who we can work with on that front, who can actually help us realise that vision, is a really big asset to us now moving forward, and gives the greatest opportunity, I think, that site master plan will actually be delivered.